So first, let's going to unlock the meaning of physical disability. So what is physical disability? Physical disability is a condition that affect movement that is an individual's gross motor control and fine motor. Gross motor require whole body movement, which involve the large muscle of the body to perform everyday functions such as sitting, walking, running, and etc. While fine motor skills are the ability to make movement using the small muscles in our hands and wrist, like writing or holding any objects. There are three examples of neurological disorder. These are cerebral palsy, spinal bifida, and spinal cord injury. So cerebral palsy. Cerebral means having to do with the brain, while palsy means weakness or problems with the body movement. It literally means paralysis of the brain. The brain was paralyzed, which explains that the problem not occur in the muscles but in the brain. It is the brain ability to consistently tell the muscle what to do. It is a conditions that involving muscle control, postures, and movement that is not progressive. When you say it's not progressive, it is not developed, which means it does not get worse over time. There are three types of cerebral palsy. The first one is the spastic cerebral palsy. It is the most common type of cerebral palsy. The muscles of students or people with these conditions look stiff and jerky. These conditions refer to hypertonia. Hypertonia is the increased muscle tone, which makes the muscles stiff and difficult or even impossible to make movement. The next one is the athetoid cerebral palsy. It is a movement disorder caused by damage to the developing brain. These conditions characterized by abnormal or involuntary movement. So the students with these conditions cannot control their muscles. So they may have sudden or unexpected twisting motions or other movement. The next one is the ataxic cerebral palsy. It is a rare condition where balance and motor coordinations are affected. Students with this condition seems clumsy and misjudging when they reach an object. They also struggle to keep their balance. And students may have cerebral palsy involving these characteristics. This is called mixed cerebral palsy.
When some children are born, the bones of the spinal column are not closed properly. This condition is called spina bifida, literally meaning a split or divided spine, and it also is a neurological physical disability. Two types of spina bifida generally do not lead to significant disabilities: the spina bifida occulta meningocele. The third type, with the technical name myelomeningocele, occurs when the spinal cord and its covering protrude from the opening in the spine. This type of spina bifida is nearly always severe. Students with this condition usually are paralyzed in their lower bodies and legs. They often have hydrocephalus, an accumulation of cerebrospinal fluid in the brain, a condition that can relieve by inserting a shunt, small plastic tube that drains the fluid. They also are likely to have various seizure disorders as well as bladder and bowel problems. Spinal cord injury. Particularly among adolescents, spinal cord injury are an increasingly common source of neurological physical disabilities. These injuries occur when there is a break, severe bruise, or other damage to the spinal cord that affects motor and sensory functions. It is through the spinal cord the most messages are carried from the brain to various parts of the body back to the brain. With a spinal cord injury, the brain cannot communicate with the body, and result is paralysis. The type and extent of paralysis is determined by where the injury occurs. The higher up the spinal cord toward the neck, the more extensive is the paralysis. Musculoskeletal disorders. Muscular dystrophy is actually an entire group of genetic disabilities, but the most common and most severe form of it is called Duchenne muscular dystrophy, For the French neurologist Guillaume Benjamin Amand Bichine, he is the first one who first described it in 1860s. This occurs when a protein called dystrophin, used by the body to keep muscles working properly, is missing or significantly deficient. Juvenile rheumatoid arthritis. So, arthritis refers to the inflammation of the joints, and it exists in more than 100 forms. Juvenile rheumatoid arthritis, or GRA, is a form of this disease that is diagnosed when symptoms last for more than 6 weeks in children who are 16 years of age or less.
The effects of traumatic brain injury. First is cognitive skills. Students may experience difficulty with reasoning, problem solving, memory, and organizations. From the word itself, cognitive, they are having a conscious intellectual. As what I've mentioned, in reasoning, she was having a hard time responding what others says, and problem solving specifically in mathematics, and all of that. And in generalization, the memory of a certain person was being affected. Second, processing ability. It affects the speed at which students can interpret the information that comes to them all through their senses. From the word itself, processing, a certain students having a hard time to process all the information that comes to his mind. She don't have that ability to organize the messages into their mind. Third is language. Some students may experience speech and language disorders. I know that not only those students that has a traumatic brain injury can experience this language, that they can speak fluently, but also to the normal students, they are having a hard time to comprehend that certain language, especially as the Filipino. We can speak the English language or our universal language well, but we are trying to. And these people who have a traumatic brain injury, they are really literally that have a hard time on giving or speaking that fluently and comprehend the certain language. Fourth is academic achievement. Because of the injuries, many students regress in their levels of achievement and may struggle to regain lost skills and learn new ones. From the word itself, academic achievement. Imagine you are sitting in the chair and you have sensed that there are certain students that have a weird actions, and you have just give a judgment runs easily, but you don't know the feeling of a certain students that she maybe lost her confidence. That's why the people who have experienced this traumatic brain injury back out and they would just lost their academic achievement. The academic achievement that they want to improve, that they want to achieve, was being affected and stopped because of that. But not just also by the judgment and runs to the other students from that certain student who have a brain injuries, but also the students who have experienced that kind of injury may be affected because she can't control, she can make the things well. That's why she was having a hard time responding into it. Fifth is emotions. Students have experienced this traumatic brain injury, often are characterized as having changed personalities also. So those students who have experienced this traumatic brain injury, also their emotions was being affected, that they can't control into it, that they just feel the anger, that they are being upset to that certain person or to certain people with no valid reasons. Because of that, their emotion was being affected. And the sixth is behavior. Students with traumatic brain injury may have behavior problems similar to those of the other students. So from the word behavior, so as we go backward, In that emotion, the results of that emotions, as they feel the anger and the absence, their behavior also become changed. Their behavior also become out of control. That they will just hit others physically with no valid reason, with no permission. And also when they're being employed or they are being or in unemployment, they just refuse the work or they just do such thing without no valid reasons because they can control also their behavior because of their emotions that they have shown. And that was the six effects of traumatic brain injuries. The first is cognitive skills, second is processing ability, third is a language, fourth is academic achievement, fifth is emotions, and sixth is the behavior. And that was the effect of traumatic brain injuries.
Hello everyone, I'm Gabriel Nico A. Pakibot and I'm going to discuss other health impairment. Other health impairment is the lack of strength, energy, or alertness, as well as to heightened sensitivity to environmental stimuli that leads to a lack of awareness to educational setting, negatively impacting for a child's educational performance because problems may include in missing classes for unpredictable and prolonged time periods, and difficulties of attending classes full-time or on a daily basis. There are six examples of other health impairment, and these are asthma, epilepsy, HIV and AIDS, cancer, sickle cell disease, and lastly, diabetes. For us to know about these examples, let's define each. First is asthma. If we say asthma, it is a lung disease that causes episodes of extreme difficulty in breathing. For some children, it is fairly benign. If we say benign, it doesn't spread to other parts of the body or invade nearby tissues. These problems may cause such as coughing, especially at night or in the morning, wheezing, uh, whistling sound when you breathe, shortness of breath, and lastly, tightness, pain, or pressure in your chest. Epilepsy. Epilepsy refers to a neurological condition in which damage to the brain leads to unperiodic sudden, uncontrolled bursts of electrical activity that may seen as seizures. HIV. HIV stands for Human Immunodeficiency Virus. It is a virus that can take over cell's own genetic material and produce more disease cells. And this cell is called CD4, which the HIV attacks. Once the HIV enters the CD4, it will produce more disease cells or HIV. And for your information, HIV is an STD or sexual transmitted diseases. However, some STD is curable and some are not, and one of the examples that is HIV. HIV is not curable, but the symptoms can be controlled. Once HIV is left untreated, it will become AIDS, and AIDS stands for Acquired Immune Deficiency Syndrome. It means it is a collection of old illnesses. You are already vulnerable to any diseases will come. The recurrence of fever or tuberculosis. And AIDS is the last stage of HIV. Cancer. Cancer is the uncontrolled division of abnormal cells. There are two most common types of cancer, and these are leukemia and brain tumor. If we say leukemia, it is a cancer of body's blood-forming tissues, including the bone marrow and the lymphatic system. And the brain tumor is the mass or growth of the abnormal cells in your brain. Sickle cell disease. It is a disorder that affects the parts of the red blood cells that carries oxygen from the lungs to other parts of the body. The difference between the red blood cells and the sickle cell disease is its shape. If we say red blood cells, it is round and can be bent. Unlike the sickle cell disease, the shape is crescent. Lastly, Diabetes. One additional health impairment to mention is type 1 diabetes or the juvenile diabetes. It is a metabolic disorder in which the body cannot properly break down the sugar and store them. It is also a condition in which your immune system attacks the insulin making cells in your pancreas, and these cells are called beta cells.
Good day everyone, I am Trisha Gonzaga and today we're gonna tackle about the first aid of seizures. But before anything else, let's get started by answering the questions, what is a seizure? Well, in a very basic level, a seizure is an abrupt and sudden episode of abnormal brain cell activity in our body. It is also known as convulsion, and I think you are familiar with these kinds of words. Seizures has different types. These are the grand mal seizures and the non-convulsive seizures. Grand mal seizure is a type of seizures that causes violent muscle contraction and loss of consciousness. So they are the most dramatic type of seizures, causing rapid and violent shaking movements. While the non-convulsive type of seizure, it is the opposite to the dramatic one. The person who has this type of disease can only feel dizziness and full of stomach. I know some of you been encounter a person having seizures. So these are the things you must do or remember if ever you're in a situation that you witness a person's having seizures. These are the first aid for grand mal seizure. First, keep calm. If we encounter people having seizures, don't panic. You need to stay calm so that you can ask help nearby or call the ambulance. Second, don't hold the person or try to stop his movement. There isn't much you can do to stop the seizure once it started, but you can help protect someone from harm during zone. Third, you need to time the seizures to measure its length. Timing the seizures with a watch is helpful because a brief seizure may seem longer than it really is, and there is instances that a doctor might ask you on how long the seizure is. 4. Clear the area around the person having seizures. If you want to do something for the person, focus on keeping them safe. Clear hard or sharp objects like glasses or furniture away to the person having seizures to avoid another injuries, because the person who's experiencing seizures cannot control his or her movements. 5. Turn him or her gently onto one side. This will help the person breathe because it helps to clear the airway. 6. Stay with the person until seizure ends. Don't leave the person who's having seizure alone. Stay until they are aware of everything and can respond normally when you talk to them. These are the first aid for non-convulsive seizures. First, watch the person carefully. By watching the person, it will help a lot because you can explain to others what is happening to him or her. Because often people who don't recognize seizures think that person might drunk or whatsoever. That's why you need to watch carefully. Second, speak quietly and calmly in a friendly way. To help the person, you need to approach him or her in a friendly way. Talk to her about what happened so that they will have the idea that their disease are happening. Third, guide the person gently away from any danger. As what I have said earlier, we need to clear the area around the person having seizures to avoid another injuries. And if ever you're in a public highway, help the person to go to the safest place. 4. Stay with the person until full consciousness. Since you already helped that person, it means you have the responsibility. So, you need to stay and wait until she recovers, and by that, you can also offer her to get back home. So, those are the first aid for seizures that you need to remember and you need to do if ever you encounter a person having seizures.
Characteristics of individuals with physical and health disability. Cognitive and academic characteristics. Students with physical and health disabilities have cognitive and academic ability that range from extraordinary giftedness and special talents to significant mental retardation and limited ability to achieve academically. Behavior characteristics. Some physical and health disabilities are associated with the presence of behavior problems. Perhaps the clearest examples occurs among students with traumatic brain injuries. These students often cannot make judgments about appropriate behaviors, and they become anxious and frustrated when they are not told exactly what to do. Emotional characteristics. One widely reported characteristic of students with physical and health disabilities is poor self-esteem. Students who have cerebral palsy, spina bifida, or asthma may ask why they have to be born with their conditions, and they may think of themselves as less valuable than others. Social characteristics. Students with physical and health disabilities also frequently need interventions related to interacting with peers. For some students, this need relates to explaining their conditions to peers and responding when others tease or bully. However, for the others, the need is for social skills training to learn or relearn how to communicate with their classmates. Physical and medical characteristics. For students in these groups, some mention must be made of their physical characteristics. Many students in these groups were more knowledgeable about hospitals, medication, and emergency procedures than many adults. Some must take medication during school hours, and some must monitor the foods they eat and the activities in which they participated. No single statement can be made about their physical and medical needs, except to mention that this domain is the one that probably is the basis for special education eligibility, and that professionals working with students in this group should learn as much as they can about each student's condition, risk, and needs. Severe disability refers to a functional impairment in one or more areas that severely affects an individual's ability to undertake important life activities. Recommended educational practices for students with physical and health disabilities. Access to education. When typical learners and those with high incidence disabilities come to school each day, the rays are centered through the classroom door, put their books and materials away, slip into their seats, chat with friends, and begin their written or reading assignments. For students with physical or health disabilities, every one of those small activities may need an accommodation. Aids for posture and mobility. A second concern is how students move around the classroom and school. Wheelchairs have been mentioned for students, but These are not the only options. Some children may have IEPs calling for the instruction of mobility skills. Aids for communication. Like students with communication disorders, some students with physical and health disabilities require assistance to communicate with their teachers and peers. Some use communication devices and other technologies in order to convey their thoughts and needs. Aids for learning. In general education classrooms, you might find that many of the instructional strategies presented throughout this textbook are helpful. In addition, some students with physical and health disabilities may benefit from curriculum overlapping. In this approach, students participate in the same activities as typical classmates, but they may have different goals. Related services. Access to education for some students relates to procedures that enable them to attend school. In addition to clean intermittent catheterization as resolved in the tattoo case. Some students may not be able to chew or swallow food, and so they might receive nourishment through a tube that leads directly to their stomachs. The procedure is called tube feeding, and it might be carried out by speech or language pathologists, a special education teacher, a paraprofessional, or a school nurse. Yet, other students may need a constant supply of oxygen, and school professional may need to ensure that the oxygen equipment is operating properly. Only a few students are medically fragile, and they may attend school accompanied by a nurse who can respond to medical emergencies.